right, guys, welcome back to Full Circle with Joyce. And wow, what a discussion that was. My head is buzzing, my heart is buzzing, my eyes, I feel like my machos are just here. Very powerful story by those ladies right there. And if you'd like to support them, let me give you Miss Margaret Waweru's number. You can send to this cause 0723 462 564. That's 0723 462 564. Please do donate there and support this work. She's jumping on borders and trying to go see people who are ailing, so please do support. And remember, there's free screening at PCA Kikuyu. But with that said, let me invite my next guest onto set. Her name is Stella Kivuti. Karibu sana to the show, Stella.
Thank you very much.
And we want to talk about obsessive compulsive disorder. Now, it's normal on occasion to go back and double check that the iron is unplugged, or to worry that you might have been contaminated by germs, and even have an occasional unpleasant, violent thought even, perhaps. But does overdoing that mean that you're now obsessive compulsive, or that you have OCD? Well, that's what we want to talk about right now. And so, Stella, explain to us, what exactly is OCD? Because I feel like it's almost a term we kind of misuse quite a bit.
True. It does get misused a lot. When you see someone who's likes the things very particular, likes to arrange their table, or doesn't like getting dirty or germs, we think, oh, they're just OCD. But in reality, OCD, or what we call obsessive compulsive disorder, is a disorder whereby you have very persistent, repetitive thoughts that are unwanted and most of the time intrusive, and they tend to bring a lot of anxiety.
Wow.
So what you've talked about, for example, the fear of germs or contamination, now this person will go overboard and try and get as clean as possible.
Yeah.
And oftentimes the obsession is followed by compulsion. Now this is a repeated behavior or even a mental ritual. It could be something as simple as washing their hands. We will wash our hands maybe 2 times a day. This person can do it like 50 to 100 times a day.
Wow.
Just
Because their thoughts.
Their thought is,
saying,
I need to get clean, I need to get clean.
Yeah.
The compulsion tends to be more excessive. It doesn't really match the obsession that they're trying to deal with.
Okay.
But it's an attempt to relieve anxiety that they're feeling.
Wow. So what are then the true symptoms of the signs and symptoms? Because now I feel bad, because if someone is struggling, like if those are certain thoughts in someone's mind, and here because we're detailed about a thing or two, we say, oh, you know, I'm kind of OCD. It's almost, in a way, it's almost insulting to someone who's actually struggling with it. So what are the actual signs and symptoms of OCD?
When you're looking at diagnosing OCD, or when we look at diagnosing OCD, there are 4 criteria someone has to meet. First, they need to have an obsession or a compulsion, or even both.
Okay.
So it's possible to be diagnosed with OCD with only one of them. Now, with an obsession, it needs to be something that is interfering with your day-to-day life. So for example, you're going to be late for work for 2 hours because you are folding and unfolding clothes over and over and over again. It's going to be something that you can't control. So the intrusive thoughts, the persistent images or urges to do something or to see something, or that in itself, that urge, those images are there. And this is something that will now affect roughly at least an hour of your day. So out of your entire day, at least 1 hour is consumed by these obsessions or these compulsions.
Wow.
The compulsion in itself could be something, we categorize them in the following areas. There's cleaners, they're checkers, they're repeaters, and they're arrangers.
Okay.
The cleaners are the people who will try and clean everything, whether it's washing their hands, whether it's cleaning the whole house. They'll have a section of the house sectioned off just for them. The repeaters are people who will count or repeat statements over and over again. So it'll be simple as turning on a light switch. They'll do it 5 times.
Wow.
And then they'll be okay, because they're trying to prevent something from happening. You see, they're trying to deal with the obsession. It could be the arrangers who like things very, very symmetrical.
Right.
And if it's out of order, they feel very anxious. So for example, you could be walking past Mr. Price and you see clothes lined up and they're not in order. You'll keep walking. This person will stop and actually go and arrange.
Like these cushions.
Yes.
Like this is upside down.
So this already is upsetting someone somewhere.
Oh dear.
Then there are the checkers. They're the people who, like you said at the beginning, when you check the iron box is off once, you're like, okay, fine, let me just double check to make sure we're okay. But then you come back 8
Triple
times.
check.
13 times.
Check.
You keep coming back over and over again. Now that becomes a problem.
Okay.
So those are times when you can start saying, okay, maybe there's an issue. So you have the obsession and the compulsion. On top of that, it's taking a lot of time out of your day-to-day life.
So this really affects one's
Yes.
work then?
It ranges from mild to severe. So mild, you can go about your day, you can have your sessions, you can have your coffee with friends. But severe will mean that you can't move until the ritual is done or until the compulsion is sorted. You can't move forward. You can't take that step until you've finished this. You won't leave the house until you've checked the light switch 10 times, the stove 5 times, you've checked the door again, and
Yeah.
you wipe down something and then you go.
So the effects on one's life must be tremendous then, even socially, managing relationships, managing a career. The extent of it could be quite severe.
Exactly, especially if someone doesn't understand what they're dealing with. Oftentimes, at least these days, we're having the conversation of mental health, and we have this situation where we can talk about OCD. But not everyone is lucky enough to explain, oh, this is what it is. And we've misused OCD to the point where it's like, just control yourself. It's just a little bit of dirt. But in reality, this person actually has a mental disorder.
Yeah. Wow. Hey. Okay. That's a lot. That's a lot for one to have to deal with. And I guess I'm just thinking then, when does this develop? Is it when one is younger or when they're older and have lived a little? How is this sort of an inherent thing that one develops, or do environmental factors contribute?
When we're looking at risk factors towards OCD, we have areas like genetics. If you have someone in your family, be it a sibling, a parent, uncle, grandparent, who has OCD, the chances of you getting it actually go up. If you have, if you've experienced a traumatic event, for example, be it a robbery, rape, even breast cancer to some extent, you could then develop OCD.
How? What is the relation
The trauma in
between the
itself, for example, let's say someone broke into your house. You will now be checking the door to make yourself feel safe. So already the thoughts come in, the obsession of, I might not be safe in my house.
Yeah.
Someone could break in. Have I locked the door? So they'll check the door over and over and over again. Now this comes in from trauma itself. So when you're looking at mental disorders, it's possible for one to morph into another or for them to happen at the same time. So if you're looking even at OCD, you could look at another risk factor, for example, substance abuse. If you're abusing substances, it's possible for you to develop OCD.
Yeah.
Or even if you have OCD, you could try and cope
Right.
with substances.
So is this anything that you've seen in, say, children?
Yes. Often we find diagnoses starting from as young as 14, even younger sometimes with preschool kids. But you're looking at late teens, early adulthood. But there's no safe bracket of, okay, I'm past early adulthood, I'm safe. Even at 40 years old, it can be diagnosed. But oftentimes you'll find late teens, early adulthood, or early 20s. That's when you'll start seeing most of the symptoms.
Okay.
They get more severe with time, but the severity varies as you go on.
So what are the treatment options then? Because this sounds like if it's affecting life to this extent, you know, socially, relationally, you're trying to go on a date or trying to meet someone, and then there's this other side of your life and you're not even sure how to explain it to someone, or maybe you don't, they just end up seeing it for themselves, and if they don't understand it and if they don't know if there's a conclusion per se to it, you know, it could affect a lot of things. So what are the treatment options for this?
Currently, there are about 2 treatment options you have. You have medication for one. One of the causes, or what we believe to be a cause, would be biological. It could be brain chemistry. It could be just normal body functioning that goes off somewhere, so medication can sort that out. The second thing you'd have is psychotherapy, or you come in and talk to a therapist. So I could walk into somewhere, for example, like the retreat rehab, and talk to someone there and go through my symptoms. When we diagnose, okay, it is OCD, then you have a few therapy options. For something like this, we'd look at maybe cognitive behavioral therapy. It's a type of therapy where we try and look at your feelings, your behaviors, and your thoughts and how they relate together. So we've identified your behavior is going to be very repetitive and in an attempt to reduce anxiety. So also your thoughts need to be worked on. So if you can break that cycle through therapy, then hopefully, and the goal is to give you somewhat of a normal life.
Wow. So therapy, and what was the second one?
Medication.
Medication. And for the medication then, is that a long process? Because I feel like a lot of people really do struggle with that, and then you get concerned too about side effects with medication, you know, having to take them for such a long time. So is this either with the medication or with therapy, is it just being managed, or is it being cured, if you will?
Now, when you're looking at OCD, it isn't a cure kind of disorder. It's more of management. So it's trying to reduce symptoms, trying to reduce the triggers that you're experiencing, or even giving you better coping skills so that when you do experience the triggers, you know what to do. So even with medication, I know it's a long process at times, and people wonder, oh, the side effects, now I have to take more medication for the side effects. But the reality is we're just trying to alleviate symptoms for someone who has such severe OCD to try and get their life back to a somewhat normal, or what we define as normal range.
Okay. Someone on our SMS line is asking, I'm claustrophobic. Could that have any relation to OCD? Can I be helped?
Now, being claustrophobic, that's more of phobias. That's a completely different section. But you can be helped. There's exposure therapy for something like that. The same thing we would use for something like OCD. We give you a situation where we trigger one of the obsessions or the compulsions, and we see if you can go without completing it, for example, and try and show you, okay, nothing bad will happen if you don't check the door 8 times. Or in this case, you will still be fine if you stay in this closed space for about 5 minutes, 10 minutes, and eventually it dissipates.
Okay. So claustrophobia doesn't really have any relation then to OCD.
When you're looking at OCD, you have to kind of cancel out everything else before you get there, because a lot of the symptoms match a lot of other things. Someone could be obsessed with how they look, for example, and constantly be in the mirror, trying to lose weight. That in itself wouldn't be OCD. It would be now body dysmorphic disorder.
Okay.
If you're having someone who is constantly thinking about using cannabis or weed or alcohol, and then they're trying to do everything possible to try and get it, that wouldn't be OCD. That would be addiction or substance use disorder. So you have to really classify carefully.
Okay. In terms of the numbers, for the, you call them counter, did you say counters?
Yes.
The counters, right? So people who count the number of times that they do things. Someone here is asking, can OCD affect how I do things daily? We've said yes to that. And they're saying, I have to check and double check everything before I eat. I can't buy food from Mama Mboga. I can't eat outside. I wash everything twice. So, I mean, I wash a lot of things twice too. I'm very particular about like meats and blood, and but I wouldn't consider myself OCD. At least I hope. I don't think I am. So, but I mean, back to what I was saying, where a lot of us almost, in a way, self-diagnose ourselves with it. At what point would you say? Is there sort of a number that you would say at this point now it is OCD? So this person says twice. Is that something that you would concern you?
Now that it would go back into, is this affecting day-to-day life? For example, washing twice, is it just because, okay, you found a spot on the dress, so you're like, I need to wash it again? Or is it just definitely not clean, go back in again? It's that urge. Is it that you get a spot on it and you can walk away from it, or you feel the need to do it right now? Otherwise, something will happen. That is when you're starting to cross into OCD, when it starts to impair your life. It's okay to be particular about something. There are people who are like, I will not buy meat from specific places, or I won't go to this Mama Mboga. It's okay to be picky, because now maybe you ate there one time and you got a runny stomach, so you're like, okay, let's be careful.
Yeah, eat down, you better be picky.
Exactly. So it's good to be picky, and that's fine. When it starts to affect your day-to-day life to the point where your whole schedule is shifting, you are meant to now go for an important meeting, but you're here washing clothes, washing dishes. That's when it's a problem.
Wow. Oh my gosh. Okay. So for those people around, those who have now, say, OCD and have been diagnosed to have OCD, what are some of the ways in which we can best support them? Because we don't get it. Like, if you're saying this is in the mind, it's in a way someone is being tormented by their own thoughts. And so, for the rest of us out here, or if you have a family member or a friend, are there certain things that we should or should not be doing to support them?
One thing is knowing about OCD. It always helps to have information about what you're dealing with, whether that's any other mental disorder, substance abuse, or OCD in this case. Understanding what kind of OCD a person has, how mild or severe it is, and how it's affecting their life can help you make life either a little bit easier, or understand that this person can't go to this restaurant. Definitely don't take them there. It'll be a trigger situation for them. So that comes in with knowledge. Being adherent to medication should help a lot more. And even therapy, being open to hear some of these struggles. But when it comes to this person themselves, it just requires a lot of patience. It's learning to work through a lot. It's not going to be sunny days every single day.
Sure.
You're going to have some bad days. So it's also knowing in that moment the person isn't doing it willingly. It's not of their own volition. It's now compulsion, or it's just a thought that just come in and they have to deal with it. They have anxiety or distress that they're trying to deal with. So being understanding in that aspect and understanding that they are working through something is helpful.
Okay.
Just being empathetic. In short.
And so do your part. Like
Yes.
if you know you have an arranger in the house, don't leave your socks thrown all over the place. Like
Exactly. If you know you have someone who likes to really, really clean, try and maintain a clean environment.
Yeah.
It's not really enabling the behavior. It's more of just assisting.
Sure.
And playing your part.
All right. Well, thank you so much, Stella, for being here today. Really do appreciate your time and your insights. We've been talking about OCD, and I certainly have learned a lot too. I didn't realize there was cleaners, arrangers,
repeaters and counters. Or checkers.
Checkers. Ah, wow. Very interesting discussion. Well, guys, this is it. We've come to the end of our show today. Maze, the time has flown. I feel like I have a billion things to say and I just don't have the time today. But I really do thank all of you for being a part. Let me read our mention today, of course, just to remind you that Aladdin is offering a 90% discount when you shop of their clothing or groceries online. And as our dear audience on Switch TV, they're giving you an extra discount of 200 bob when you use the coupon code SWH200. You can also get, if you shop for amounts totaling to 1,000 and above, you get the chance to choose any product that will be labeled 1 bob, and that could even include a phone. And so do get shopping. Your goods will be delivered within 48 hours. With that said, I need to get out of here, but asanteni sana again. Let's do this again tomorrow as we look at change makers. Until then, have yourselves a blessed day. I'll see you soon. Ciao.